Thank you very much. Gracias por unirse a nosotros, a nuestro webinario Independencia y Empoderamiento del Empleo y vías y oportunidades para el liderazgo y el éxito, que se está trayendo a ustedes a través de Anthem Blue Cross, Elevance Health and Resources for Independence Central Valley. Mi nombre es Aubrey Alfano y yo voy a estar a cargo del evento el día de hoy junto con los colegas. Esperamos que este sea para ustedes un día lleno de conocimiento que empoderará y les permitirá empezar su jornada con éxito. Esperamos que todos permanezcan hasta finalizar este webinario donde anunciaremos quién ganó nuestro iPad. En este momento le damos la palabra al equipo de lingüística, quienes nos darán instrucciones para poder utilizar la interpretación de idiomas. First, I'm going to start with English. In a few seconds, you will see a globe or a word icon at the bottom of your screen if you are using a computer or a laptop. It will say interpretation. Please select your language, in this case English, and then mute original audio. However, if you are using a cell phone, a tablet, or an iPad for this meeting, you will see three dots at the bottom of your screen. Select interpretation and then English. Mute your original audio and finally select done to finish the setup. En este caso empezamos con español. Si se está conectando desde una computadora o una laptop, verá el icono de globo o mundo en la parte inferior de su pantalla, que dirá interpretación en algunos segundos más. Seleccione su idioma, en este caso español, y dele clic a silenciar audio original. Sin embargo, si se está conectando desde un celular, desde una tablet o un iPad, verá tres puntos en la parte inferior de sus pantallas que dirán More o Más. Seleccione Interpretación, quizás tenga que deslizar un poco su pantalla. Seleccione Español y luego dele clic a silenciar audio original. Posterior a ello, dele clic a Done o Finalizado y habrá completado la configuración para la interpretación de Zoom. Muchas gracias. Thank you very much. We are ready to start. Estamos listos para empezar.
All right.
All right, thank you so much. We will just go over a couple housekeeping items today before we begin. The chat feature is disabled. So if you do have a question during a presentation, please enter that into the Q&A or feel free to use the raise hand feature. We will take questions after each presentation has concluded and not during the presentations itself. So please be patient and we will get to your questions.
Definitely. This is a webinar, so you are muted and your video is off. So have no worries on unmuting yourself or any noise around you. That's not going to disturb us at all.
Yes, and also we will be sending the materials to our registrants as soon as we can. So just keep that in mind. That's a question that gets asked every time, that the materials will be emailed to our registrants. And so now we're going to get started with our first presenters. I would like to introduce Corey Warren and Christina Mills from Elevance Health to discuss the summer internship program and volunteerism and community service. So first, Corey is a program administrator supporting university relations and recruiting at Elevance Health. She manages the summer internship program, and with a focus on intern experience, she develops and executes the program to ensure that interns have a best-in-class experience. When she is not working, she enjoys spending her free time with her family and traveling. And I'll go ahead and also introduce Christina. Christina is going to be presenting after Corey. She is the Senior Director of Inclusive Policy and Advocacy at Elevance Health. She lives in the Bay Area and is a fourth-generation Californian. Christina is an alumna of the Youth Leadership Forum for Students with Disabilities and founder of Yo Disabled and Proud. She identifies as a proud disabled woman and mom. One of her favorite pandemic memories was when she and her 9-year-old son led a Zoom cooking class for the youth at RICV. So welcome, ladies. Welcome, Corey and Christina.
Thank you so much for that introduction, Aubrey. Good morning, everyone, or good afternoon, depending on where you are. I'm located on the East Coast, and so it is afternoon here. I'm very excited to be here with you all and to talk to you more about Elevance Health and our summer internship program. A bit more about me. As I mentioned, I'm on the East Coast, more specifically in Indianapolis. I've been here my entire life, and I've been with Elevance Health for 11 months now. As a program administrator, as Aubrey mentioned, I develop and execute our summer internship program. And so as far as an intern, what you can expect would be communication each week, detailing, what we covered that week and then what to look forward in that next week. And then I also organize and facilitate all of our program events, which I'll talk more about here in a second. And then also, I maintain relations with our target colleges and universities. And Aubrey, if you can let me know if the presentation is up, if we're ready to kind of dive into that.
Yes, we are getting that going right about now. Here it is. All right.
So thank you so much. And I am
You're
ready
welcome.
for the next slide, please. All right. And so at Elevance Health, our summer internship program is comprised of what we call pillars of success. We actually have 4 of them. If you can see on your screen, I will briefly call them out. And so the first pillar is meaningful work. Learning and development would be our second pillar, leadership exposure and networking, our third pillar, and then our last pillar is social and community engagement. And I'll talk briefly about each one of these. As far as meaningful work, that really just means that at Elevance Health, we want to make sure that our interns have meaningful project work that contributes to the business. And that means that you'd be working with real data, real research, and ultimately you would have work that aligns with your career interest and goals. With our most former summer internship class, actually our 2023 summer internship program, 93% of those interns had felt that they had received meaningful work throughout the program. And so that was really great for us. The next pillar being learning and development. And so while you're here at Elevance, we prepare you for your future career, and we also set you up for future success. And so 97% of our interns have reported that they had acquired a new skill or new knowledge during our program. As far as leadership exposure, networking is a central theme throughout the program, and we provide ample opportunity for interns to network and engage with leadership as well as amongst their peers. We had nearly 200 interns participate in every event over the summer and had over 20 of our senior or director level leadership engage with our interns, which also included our president and CEO, Gail Boudreau. Our last pillar being social and community engagement. Our community is at the core of what we do, and as well as the why. And our top rated event for our summer internship program this last summer was a virtual great gift back game show. And essentially what that program comprised of was our interns um, being able to be in teams amongst their peers, and they were able to compete and complete trivia questions. And then the winning team was actually able to donate $500 to the winning charity of their choice. And so that event went really well for our interns, and they really enjoyed the opportunity to be able to volunteer and give back some time and to also donate to an organization of their choosing. And as I mentioned, that event was actually the top rated event this past summer. And so our interns really enjoyed that. Next slide, please. So what we're offering in terms of the summer internship program, we're offering a 12-week summer internship program that will start in May of 2024 through August of 2024. And more specifically, the dates are here, but May 20th through August the 9th. All of our internship opportunities will either be hybrid or on site. And so one requirement is that if you're applying for an internship at Elevance Health, that you are within 50 miles of what we call a pulse point or an office location. And so we do have quite a few offices in the California area. We have offices, and actually our headquarters is in Indianapolis, Indiana. We have office in quite a few offices in Atlanta, in the New York, New Jersey area, the Virginia area, Florida, just to name a few, Mason, Ohio, Chicago, Nevada as well. So just to highlight a few of the locations that we have, and if you're in a specific location and have questions about if we have a pulse point in that area, please just let me know. But we're asking that all of our interns are within 50 miles of one of our pulse point locations so that they're able to be in the office 1 to 2 times or more per week, depending on the team that they support. As far as qualifications, and so we target undergrad and graduate students. Undergraduate students should be sophomores, juniors, or rising seniors. And then our graduate students are master level. We do ask that our interns, although it's not a requirement, it is a preference that all of our interns have a 3.0 or greater. But we do accept all majors. And to highlight a few of the internship opportunities that we have opportunities in finance and actuary. We have internship opportunities available in IT, data science and analytics, strategy and consulting, supply chain and operations, sales and marketing, in our HR and legal office, as well as our healthcare administration and pharmacy areas of the business as well. Ideal candidates would be those who are driven and passionate, those who like to collaborate and are agile, end-to-end thinkers, transparent communicators, those who are performance-minded, and those who are builders and change agents. And so we look forward to you all applying to our summer internship program. And the next slide, please. If you scan the QR code, that will take you directly to our career site where you can see what opportunities we have available. Most of our internship opportunities are live. We will continue to post more of those opportunities as they become available. And we'll be looking to have most, if not all, of our internship positions filled by December of this year. So a little bit of time, quite a few weeks left until we meet that deadline. And so if you're interested in interning at Elevance Health, please do apply. And then Aubrey and Jordan also have the green light to share my contact information. And so if you all have any questions for me, please reach out via email, and I'll be happy to share any additional information that I have for you all. Thank you.
Good morning, everyone. I'm so excited to be here with you today. I'm going to stay off camera to make sure we have access to our ASL interpreters. But first, before we get started, happy National Disability Employment Awareness Month. We've got a few days left of this acknowledged and recognized holiday that's been happening or Recognition Month, I should say, that's been happening for decades across the United States, and was initially started back in the 40s to ensure that folks who were coming back from military duty that were injured in service and might have a permanent disability were able to seek employment and were able to not be as discriminated against, with the government supporting them and pushing to have employment opportunities regardless of disability. So that is an exciting part of our history, and I am thrilled that Anthem California and Elevance Health has been able to work with resources of Independence Central Valley to acknowledge National Disability Employment Awareness Month. For those of you who don't know, I used to be the executive director of the California Foundation for Independent Living Centers. So you might have noticed from my bio that I mentioned Yo Disabled and Proud. As a person with a disability, volunteerism can be incredibly, incredibly important. And for years, in my role at CFILC, we had worked with the governor's office to establish the California volunteer program known as Cal Volunteers. And I've brought some links with me today that are going to be dropped in the Q&A for all of you. But just to say, you know, a little bit about volunteering and internships. While Corey covered the internships part, I think it's important to mention that volunteerism and community service is usually available for people of all different ages and really allows folks with disabilities to get to know what their strengths are in the workplace without feeling like the stress that comes with having a full-time job and being maybe required to do certain tasks that you're not sure whether or not you're able to do. So in that sense, you know, I have to say, as a person with a disability, volunteerism and community service was incredibly important in my own journey to finding a job. And I think, you know, in the independent living model, peer support is obviously one of the most important values that we bring to the disability conversation. And being able to talk about what our needs are and what volunteerism opportunities might benefit us in learning different job skills is very important. So in my own journey, I started, I think it was, you know, back at least when I was in high school, which was quite a while ago, but in California, there was a requirement then to complete so many community service hours. And for me, as a full-time wheelchair user, I'm also hard of hearing and have some other non-apparent disabilities. It was more of a challenge, I would say, to figure out how am I going to complete these community service hours. And while I could have taken a pass, the school was willing to waive those requirements for me. I felt like it was an opportunity for me to figure out what can I do as a person with a disability, because this is a great opportunity for me to figure out what getting a job is going to look like and what I might want to pursue when I go to college. And so I had decided at the time to do some community service in a nonprofit called Lifeline. And that was down in San Diego, California. And during my experience there, I completed all of my hours. The building was accessible. My needs were met in terms of my accommodations. But what I learned was that I really didn't like administrative tasks. I was doing a lot of filing, I was answering phone calls, I was taking notes, things that I realized while I could do them, they probably weren't things that I wanted to do the rest of my life. So I really felt like that community service opportunity gave me the chance to see that without taking a job and then having to quit or not being successful. And same goes for volunteerism. And a lot of times when people with disabilities are looking for volunteer options, finding an accessible option can sometimes be a barrier. There's 3 different programs that I want to talk specifically about today, and I've mentioned one, but the Cal Volunteers program has a variety of different ways that you can volunteer throughout the state of California. And they sort of have a focus of like 6 different pillars of priority. So they have College Corps. If you're a student in college, any type of college, you can look at volunteer opportunities under that pillar. They have a California Climate Action Corps. If you're interested in climate change and climate justice, maybe you choose that route. Then they have a Youth Job Corps, which is really cool. And I know a lot of folks with disabilities have done Youth Job Corps and had successful opportunities. Then there's the AmeriCorps California. And then something that some of you might be interested in if you're connected to RICV is the Disaster Volunteer Management Corps. And then there's the Alumni Network. So everybody throughout all of these pillars gets to connect on the Alumni Network. Again, we'll provide you the link to be able to see all of those and research which one you might be interested in. But in addition, there is also the Fresno Volunteer Opportunity specifically. And that one is a little bit different. It's less formal, but it has a lot of great options like volunteering for Best Buddies International through the Fresno chapter, or volunteering at Habitat for Humanities, the Central Valley SPCA. Maybe you like animals and want to see what you can do with them. There is the Peanut Butter and Jelly Ministries. I found that there's a lot of different Fresno opportunities that are very creative and provide a lot of varieties in terms of access so that people with all different types of disabilities will be able to enjoy them. There is about 25 different options specifically in Fresno for you to look into. And they range from outdoor activities to administrative activities to cooking activities to calling people for support. There is something there for everybody. So I think that that's another great opportunity to take advantage of. Last but not least is Hands On Central Valley. And I'm pretty familiar with this company because Hands On has different chapters around the state. And I worked closely with the Hands On Sacramento chapter for a variety of years. And they actually also assisted at the time in helping recruit volunteers specifically for different activities that at the time CFILC was doing. So when CFILC used to put on the Disability Capital Action Day event, which some of you might have attended, we always worked with Hands On Sacramento to recruit volunteers. And Hands On Sacramento does the same, or Hands On Fresno, Central Valley does the same thing, but specifically for your area. And while RICV and other organizations can put up the volunteers that they need, there's an opportunity for you to look at the different volunteer options within that website as well. And there's things here that are very different than even the other 2 websites I have mentioned, Fresno Volunteers and then Cal Volunteers. For example, one of the options through this website is Dance Production Chaperones, just chaperoning dances. Maybe that's something that you're interested in, or helping in a warehouse or helping in a clothing closet, packing food for folks in Fresno, or helping connect people to have relationships and be less isolated. So I think, and really what I want to hone in on today is ensuring you that as folks with disabilities, regardless of what our disability is, there's always an option. And we're very fortunate in our state to have so many different diverse opportunities for us to try out. And just because you try one volunteer opportunity and may not like it, doesn't mean you can't try more, or that maybe you want to do more than one at one time. The other thing I want to bring up before we close in this session is the credits you might be able to receive for volunteering. So at community colleges and sometimes state universities, but it does depend on the program, you can also get credit at school. So you might be able to earn 3 to 4 units per semester, depending on the number of hours of service you provide. But one of the things you want to make sure of is knowing whether or not they count community service or only volunteering. There is a little bit of a difference in each program, but they are very similar at the same time. All of the options that I've given you today are really focused on volunteerism, But in terms of community service, your school might be requiring it. And in those situations, I would encourage you to reach out to the same agencies to complete your community service hours. Thank you guys for joining us today, and I look forward to any questions and being a part of the rest of the agenda.
Definitely, thank you. If you guys open up the Q&A, you'll see the 3 different links that they have provided. So we have volunteer opportunities, Cal volunteers, and hands-on Central Valley. So far, a person asked who won the raffle. We haven't yet done the raffle. The raffle will happen at the end of today's webinar. So the people who stick around at the end are the ones who are entered to win the raffle. But do we have any questions about volunteering? Yes, the links to these websites will be sent to everyone. At the end of the webinar, I'm going to send an email with all the information that has been given, contact information of the presenters. So everything will come in a nice little email sent out to you.
All right. Well, please feel free to add to the Q&A at any time if a question arises, but we will move forward to introduce Lisa Nickel. Lisa Nickel is from Anthem Blue Cross, and she's going to be presenting today, My Care, My Choice, transitioning from my parents' health insurance to my own. And while we pull up your slides, Lisa, I'll read your bio. Lisa Nickel is an RN who supports special programs at Anthem, such as CalAIM Enhanced Care Management Program. Lisa rescued a kitten around July 4th, and he has been a handful. And the last 4 months has felt like 4 years. I know how that goes, Lisa. He is like any baby or toddler that she has always had to keep an eye on, and he races around the house, knocks things over, and bothers her adult cat. His favorite activity is climbing curtains and sliding screen doors. Welcome, Lisa. Thank you for that wonderful bio.
Yes, thank you, Aubrey. Thank you, everyone. Like right now, I'm hoping that they both stay in the other room. So far, so good. Yep, so thank you and happy Friday, everyone. We're going to jump into this PowerPoint slide deck today and talk about some basics around healthcare and healthcare insurance. Let's start with our next slide. So there is so much to learn about healthcare and healthcare insurance, which more than we can cover in this 1-hour presentation today, but we can just begin to talk about some of the basics. First of all, we want to know, why is insurance so important? You know, what do I need to know? We'll talk about some of the key words or language that you'll hear a lot around healthcare and healthcare insurance. We'll touch on the 10 essential benefits that every health plan must offer you when you enroll in insurance coverage. We're going to speak briefly to Disability Benefits 101. And by the way, I want to invite Christina Mills to interject or jump into this presentation as well, because this week it was Christina who introduced me to Disability Benefits 101. So a lot of great information coming down the road here. We don't want to forget to talk about your rights. You have rights as a patient or a member of a health plan, and we want to cover some of those healthcare rights. And then hopefully you're excited and want to know more, and you say, how do I sign up? Where can I get additional help? Let's go to our next slide. All right, so why is health insurance so important? Well, because it's about you and your health. So, health insurance, what's the big deal? Well, if you think about the cost of healthcare today, and maybe you haven't thought about it too much, but I'll tell you, costs of healthcare continues to go up. And without health insurance, those costs can really add up fast. We're talking hundreds to into thousands of dollars. If you have an accident or deal with a serious illness and you don't have insurance, it can be very, very, very expensive. So, but with health insurance in place, and because you don't know when things may happen, it's good to have it when you need it. And what else? You're probably coming off of your own parents' health insurance coverage. And as a child under your health insurance, as a child of your parents' health insurance, many of the decisions were being made for you. Your parents made decisions for you. Your doctors and your parents together made decisions for you. But now, as you're becoming adult and you're in this stage of adulting, you're responsible to understand how to manage your health care and how to select insurance. These are really big decisions that you'll be able to make in your young life. And increasing your knowledge around healthcare will also help you select an insurance plan that is right for you, help you select an insurance plan that you can afford. So the exciting thing is this is a major place for you that you can start taking charge of all of your healthcare needs. We'll go to our next slide. So health plan basics. We're going to talk briefly about what is Medi-Cal, what is managed care, and what is an employee-sponsored health insurance plan. Let's go to our next slide. What is Medi-Cal? Many of you probably have heard of Medi-Cal. This is a California Medicaid healthcare program that has been designed for individuals who meet eligibility requirements. Many times that means they fall into certain income categories or low income, have low income, and they also maybe have a disability that qualifies them for Medi-Cal. So Medi-Cal pays for a variety of medical care for children and adults, again with limited income. This Medi-Cal coverage is paid for by your federal and state tax dollars. And as mentioned, your Medi-Cal benefits is available to you if you are disabled or have low income levels, and you can get Medi-Cal if you are also receiving some kind of Social Security or supplemental security income or other government assistance. So for example, if you're one person living in your household by yourself, you don't have any dependents that you're responsible for, it's just you, and your income falls below around $20,000 a year roughly, and you're considered disabled, you may qualify for Medi-Cal. Let's go to our next slide.
And this is Christina. One thing that I will say on that is something that gets a little confusing for those of us with disabilities is how it can be defined. And so keep in mind that the way Medi-Cal and Medicaid, which is the federal version, defines disability might be different than the way your school has defined disability or the way the Americans with Disabilities Act defines disability. So you really have to know, how do they define disability to know if you will qualify based on the disability you have.
Thank you so much, Christina. Appreciate that. All right, let's go to our next slide. What is managed care? This is another term or language you may have heard around healthcare. You may be familiar with the term HMO. So HMO means Health Maintenance Organization. And because, healthcare costs are so high in the US, a program was designed called an HMO that is meant to provide high quality services at a reasonable cost. So if you have an HMO plan, you know that you will be assigned a primary care provider, PCP, which is your doctor. That's your first doctor that you go to see for any of your healthcare needs. routine care, you got the flu, something, more serious has happened to you, this is the first doctor you go to see to treat your condition or even diagnose your condition. And that primary care doctor, if needed, will refer you to other doctors within his or her medical group of other doctors. So if you need a specialist, if you need to see someone for physical therapy or orthopedics or endocrinology, it's your primary care doctor who you will see first, who will then create referrals for you to see these other doctors. And all of these doctors work together in this medical group, or what's called a network of doctors. And that's the network or group that all of your care is managed by. Your doctor needs to send you to the hospital. There's a certain hospital that you can go to. If they need to send you for labs, they'll tell you where to go for labs. All of this is kind of managed in this HMO plan to manage costs while still providing you high quality care. Let's go to our next slide. So some of us are out there looking for jobs, and you're getting your first job, and your employer has a health insurance plan that they sponsor for you. With this health insurance sponsored by your employer, there's some great benefits. If your employer provides health insurance for you, they may share the cost of that insurance coverage with you. There's what we call a premium. A premium is what you pay up front for your health insurance coverage. That can kind of add up to hundreds of dollars a month. Your employer may share the cost of that premium for you, so it doesn't cost you so much. Another benefit of having an employer-sponsored health plan is, there's so many healthcare insurance options out there today. If your employer chooses a package or a dozen different healthcare insurance plans for you, that makes your choice easier. You don't have to choose from 100 of them. You can choose from 10 of them, for example. And as mentioned, that premium, that upfront cost for your insurance, money is taken out of your paycheck in advance to cover the cost of that premium, and that money is not taxed. So that means you're going to save a little bit more money and keep more money in your pocket. Let's see if we can go to our next slide. So some of the many terms, there's many words and phrases and terms around healthcare out there today that even all of us sometimes have to keep a dictionary to kind of keep up with. We're just going to touch on a few of them and talk about what some of these terms mean. Let's go to our next slide. As we mentioned, we talked about a primary care provider or PCP. And again, with a managed care HMO, you're assigned a primary care provider who acts as a quote unquote gatekeeper. That's the first person you go to for all your healthcare needs, and then they can refer you to other specialty care services. The nice thing about this primary care doctor is if you choose an HMO, a primary care doctor will be assigned to you, but you can change that primary care doctor. You can look at a list of primary care doctors that you can get from your insurance company and choose the primary care doctor that you want. If you go to a primary care doctor and you're like, this is not the right person for me, you can always change that primary care doctor. There's a process to do that, and your insurance company will guide you through those steps. There's also a plan called Preferred Provider Organization, or what many of us just call a PPO. So a PPO is another type of managed care health insurance that provides maximum benefits if you visit a doctor in that small network of providers, but also allows you to go outside of that network of providers to see other doctors. So the PPO, you can see doctors within a network at a reduced cost, not as low as an HMO, but still a low cost. But it also allows you to see doctors outside that network, but at a little bit higher cost. So the advantage of a PPO is you have more freedom of choice and greater access to doctors. but you pay a little bit more. Let's go to our next slide. Premium, as mentioned earlier, that premium is money charged for your insurance coverage up front. And in most cases, if this is on a plan offered by your employer, and your employer will share the cost of that premium. Some plans also have what is called a deductible. So a deductible is money you have to pay out of pocket for healthcare services before your insurance begins paying. Most HMOs do not have deductibles, but some do, and most PPOs have deductibles. Again, cost of healthcare is so expensive. There's different little ways that we have to pay for the healthcare services and the insurance to cover us when we need it. Out-of-pocket cost, that's the cost for medical care that is not paid for by your insurance. Some plans also have out-of-pocket costs, but the good news is you're not paying out-of-pocket forever and ever and ever. There's a maximum out-of-pocket that you will have to pay per year before your insurance begins covering you at 100%. So these are all like key little details that you want to be aware of and pay attention to when you're selecting insurance. Let's go to our next slide. Just a couple more cost terms or cost words is co-insurance. Co is usually means together or, two. So co-insurance is a certain amount of medical charges that you pay, with the rest of the charges being paid by your health insurance. And this usually comes into play after your deductible has been met. So co-insurance may be your insurance pays 80% of your healthcare costs for a doctor's visit or a hospital stay, and you pay the other 20% out of pocket. And the next one is copay. This is, again, a way of cost sharing. So with a copay, you pay a certain dollar amount of total health-related charges, and your insurance pays the rest. So copay, for example, usually applies to like ER visits or specialist visits or pharmacy benefits. So for example, you may have a copay. You may not have a copay if you go to see your primary care doctor, your main doctor, but you may have a copay to go see a specialist. Or you may have a copay to go to urgent care, but then you may have a higher copay to go to the emergency room. So these copays are lower when you access your main doctor or your doctors in your medical group, and that's because insurance health plans want you to be really proactive and focus on preventative care. Staying in touch with your doctors and getting routine care helps you to manage your health better and can hopefully prevent disease down the road. But if you wait and if you don't go to see these doctors on a regular basis or as directed by your provider or doctor, something may sneak up on you, a health condition over time that forces you to go to the ER. And it's so much more expensive to go to the ER. So this is really kind of designed to help you be more mindful of managing your care and more engaged in your health care overall. Let's go to our next slide. So this is great, 10 essential health benefits. These are things that your health benefits must cover when you get insurance. Let's go to our next slide. So years back when the Affordable Care Act became a law, part of that Affordable Care Act requirement was that all insurance plans must provide these 10 essential health care benefits. So any health plan that you select through your employer, through Medi-Cal, every one of those insurance plans must cover outpatient care, prescription drugs, pediatric services, which includes dental and vision coverage for children. These essential health benefits also include preventative care, lab services. We'll go to our next slide. Also, emergency services, hospitalization for surgery, overnight stay, and other conditions. Your insurance coverage must also give you mental health coverage and access to substance use disorder services. Your insurance plan must also provide rehabilitative or habilitative services. So like a rehabilitative service or rehab is a health service that helps you keep or get back or improve skills and functioning for daily living that has been lost or impaired because you were sick or hurt or disabled. These services may include physical therapy, occupational therapy, speech language therapy. It may also include psychiatric rehabilitation services in inpatient and outpatient settings. Habilitative services refers to a process aimed at helping individuals with disabilities attain or keep or improve skills and functioning for daily living. And for pediatric patients, habilitative therapy often aims to help a child develop motor skills that they had yet to accomplish. So all of these services should be accessible to you when you choose an insurance plan. And lastly, another important essential health benefit is services to support you around pregnancy, maternity, and newborn care. Let's go to our next slide. We're going to talk a little bit about your rights as a patient or a member of a health plan. Let's go to our next slide. So I like to remind people that they have certain rights when they have healthcare insurance or healthcare in general. Many people don't realize that they have these rights, but so that's why we want to mention them here. Did you know that you have the right to an appointment when you need one? Did you know that you can request continuity of care with your doctor or if your doctor or medical group leaves your health plan? So this one means sometimes when you are assigned like to an HMO and you have this primary care doctor or specialist who's been treating you for some time and you're in the middle of a really important treatment program and that doctor has to leave for whatever reason, they tell you they can no longer be your doctor, or perhaps that medical group that your doctor is a part of no longer is a part of the health insurance plan that you have selected. You're like, oh my gosh, what's going to happen to me? I'm in the middle of treatment. I'm getting this care. What's going to happen? Your right is to continue that care. The insurance plan will work to get you to a different doctor and a different medical group who can continue providing that care that you were receiving without any kind of break or delay. So that's continuity of care for you. You have a right to that. The next bullet says you have the right to receive treatment for certain mental health conditions. It used to be health insurance companies were not really required to provide mental health services. And, you know, everyone's talking about mental health these days and how important it is and how much we want to, you know, get the care that we need when we need it. So that is another benefit that you have access to that cannot be denied. You have a right to a second doctor's opinion. Suppose you go to your primary care doctor and he sends you to a specialist and that specialist gives you a plan of care and you're like, I don't know, I'm not sure I agree with that plan of care. I have concerns or questions. I want to see a second doctor. I want to get a second opinion because I just want to make sure I'm getting the right care that I need. You have the right to ask for a second opinion from a new doctor, from your insurance company. And if your health plan denies your service or denies a certain treatment that you wanted or you think that you need, you have the right to know why that health plan, that insurance company denied that service or treatment. They should give it to you in writing. This is why we're denying this service. That is your right. You have the right to understand how your health you have the right to understand your health concern and treatments. So it used to be, and I keep saying it used to be, people would go to a doctor and they would just think that the doctor knew everything. The doctor tells me what to do. I'm going to do whatever the doctor tells me to do, regardless of what I think or feel. The doctor knows best. Today, we want to be more patient-centered or member-centered in our healthcare. you are a part of that decision-making process with your doctor. You can ask your doctor questions and expect to get, some understanding or to make sure that you are in agreement with the plan of care designed for you or the treatment that they're suggesting. So it's your right as a patient to understand your health concerns, your health needs, and those treatments that are being recommended for you. Along those lines, you also have a right to see written diagnosis or description of your health concern. You have the right to ask for your medical records to see those when you want to. Maybe you may even see information in your medical record that you think, nope, I think that's incorrect. That's an incorrect date or that's an incorrect diagnosis. And you have a right to dispute that information to make sure that your medical record reflects everything correctly. There's a process for that as well. And ultimately, you have the right to give informed consent when you have a treatment. So again, your doctor, you don't want to just let your doctor tell you what treatment you need without question. You want to understand what that treatment means. You want to give consent to that treatment so that you were a part of that planning process. You were at the center of the care, and it's important that you give consent to any treatment recommended. Let's go to our next slide. This is a great slide here where we talk about notice of non-discrimination. So many on this call may be aware that discrimination is against the law. In fact, probably everyone on this call is aware that discrimination is against the law. And health plans must also follow these laws that are written by the state and federal, at the state and federal level. So when we talk about notice of non-discrimination, it's important to know that health plans may not discriminate against or exclude or treat people differently because of your sex, your race, your color, your religion, your ancestry, or national origin, or ethnic group identification, or age, or mental disability, or physical disability, or your medical condition, or your genetic information, or your marital status, gender identity, or sexual orientation. Health plans may not discriminate against you in any of these areas. So when you select a health plan or an insurance plan for you, pay attention to see what free aids and services to people with disabilities is offered that will help you communicate better, such as, do they offer qualified sign language interpreters? Pay attention to ask if they give written information in other formats. For example, do they give you information, flyers, materials that's in large print or in an audio version, or is accessible with other electronic formats? Do they offer free language services to individuals whose primary language is not English? Which means, is your health plan or your insurance giving you access to qualified interpreters? Are they providing information and written material in other languages besides English? Most health plans, all health plans, I'll say, do so, but it's good to ask questions around this and how to access that information when you need it. Let's go to our next slide. Right to file a grievance. So sometimes you just may not agree with the plan of care your provider's recommending, or maybe your insurance company says, no, we're not going to cover that service. Or maybe you find that you are unlawfully being discriminated against. You have the right to file a grievance with your health plan or insurance. You can do this by phone, by calling the member services department of that insurance company. You can also do it in writing. You can also go to your doctor's office and ask them to help you file that grievance. You can even walk in, go to your health plan office to do that as well. But the key here is to check with your health plan that you select for more details. That's not your only option. If you need to, you can go to the Office of Civil Rights, the California Department of Healthcare Services. You can access them by phone and ask to kind of share your grievance or document your grievance. You can reach out to them by writing and file your complaint. There's a way to do that electronically as well. And at the bottom of this slide is the website to get complaint forms for the California Department of Healthcare Services. Our next slide, please. Another option is to go to the Office of Civil Rights or the U.S. Department of Health and Human Services. So again, if you feel like you have been discriminated against in any way, you can file a civil rights complaint through the U.S. Department of Health and Human Services by phone, in writing, or electronically. So these are, we just want to, we're not going to dive real deep into this topic, but it's just good to know you have a right as a patient and a member to challenge or question a decision that's been made. And the health plan will review your complaint or your grievance, and the health plan is responsible to respond in a very timely manner. And the health plans are responsible to acknowledge your complaint within 5 days and to kind of come to a decision after research and reviewing your complaint and give you an outcome in 30 days. And that's not the end there. There's even more direction. If you're still not happy, there are steps and processes that you can be directed to try to reach a resolution. All of that is available to you by your insurance. Go ahead.
This is Christine. I just want to add how very important this opportunity is, because as people with disabilities, we oftentimes don't know who to contact when these situations come up. And while Lisa is doing a phenomenal job of sharing how to go through the process, I also just want to note that it is these entities are responsible to help you fill out the form if you're not able to do it yourself. So I know it can be very overwhelming, but there's also support there that's supposed to be provided through this process if you need it.
Awesome. Thank you, Christina. Let's jump to our next slide. This is an exciting section here. Disability Benefits 101. So again, Christina shared this with me this week. So I'm hoping Christina can fill in the gaps as we talk about this section. Let's go to our next slide. So there's this great website, Disability Benefits 101 or DB 101, that lets you go onto their site and you can learn how work and benefits go together. You can see how your supplemental security benefits support you while still working. You can even find programs at this website to help you find work. And also you can discover ways to save up money while working. All this information is shared on this website. This
is Christina. Just to add real briefly, this is a really unique website to California. When Lisa and I were updating this deck, it used to be that only 6 states in the country had a disability benefits website. It's very specific to each state. It has a calculator on it, so it's incredibly helpful for any different type of California benefits you're receiving and how it might impact you going to work. And if there is an impact, what you can do about it. But when Lisa and I were looking, there's now about 10 states in the country that have it, but it's oftentimes not known about. So the more we use this website, the more empowered we are to know what options we have when it comes to going to work. Because we hear things and wonder, am I going to be able to go to work because of my disability? And the answer is yes, absolutely. And that's why we're covering community service, internships, volunteerism, and then that next step, work. But a lot of times, including myself, when I transitioned from, community service and volunteering to work, I was on SSI for 24 years of my life. I was dependent on Medi-Cal. Using this website is an amazing way to figure out, okay, maybe I lose my money coming from SSI, but I keep my Medi-Cal benefits. How much money can I make and still keep my Medi-Cal benefits? This information is on this website.
Awesome. Yep. So if you have a work plan, you can plug in some information to see how your work plan impacts your benefits. Suppose you want to work and you're trying to stay in school. There's a way to research how both of those factors impact your benefits. And I think as Christina was referencing, there's this Working Disabled program and how you can keep your Medi-Cal while still working and disabled. And another great thing that was really new to me, which I think is pretty exciting, is the ABLE accounts, right? So this is a saving accounts program that allows you to build up savings without impacting or losing some of your SSI benefits, right? So the savings can grow without being taxed, and it allows you to grow up to, I think, Christina, $100,000.
That's correct.
Without impacting your SSI, and as long as you meet some of the other SSI rules. But even if you go over the $100,000, that means your SSI will stop. But if you spend down that money below $100,000, again, you get back your SSI benefits without having to reapply. So the bottom line is the ABLE account means that you can save up money without losing your benefits. And also it lets family and friends give you money without affecting your benefits.
And we all know that annually when we do our reevaluations for SSI, there's a question, have you received any money or gifts? And I know a lot of times, we're unsure about how to answer that question. But if we are receiving those gifts through our CalAble accounts, it's perfectly okay. You're completely eligible for that. And the greatest thing, I was sharing with Lisa, that I almost see it like a retirement count for people with disabilities, or a catch-all, because sometimes when we go to work, maybe there's a situation where our disability is progressive, or we have another disability, and then we are limited to work. Instead of being required to spend down all of our money to requalify for Medi-Cal, the money in your CalAble account is treated differently. And so for those of us with disabilities that, are always worried about having to maybe go back on benefits someday and not be able to keep the money that we've saved or earned during our working years, this is an opportunity to do that.
Yeah, and Christine, I think you were also sharing that sometimes you may have expenses related to a disability that you cannot get covered in any other manner or reimbursed, and you can get those reimbursed through this account.
That is so right. So all of those unique expenses we have, maybe we have assistive technology that's not covered under our health plan or regional center or Department of Rehab, but we have money in our ABLE account and it's a disability expense to have that technology. That's an expense you can actually use through your CalAble account. And while CalAble is a savings plan, there's also a debit card attached to it so that you can use it at any time to cover disability expenses. And we all define disability expenses maybe a little bit differently based on our unique needs. But as long as you can prove that that is a disability expense, it is exactly that. So I'll give you one that's unique that many people may not think of. While I'm a chair user, I'm also a little person. And that often means that whenever I buy clothes, I have to have those clothes altered almost every time. That's a lot of money that I have to pay to alter my clothes because of my disability. I actually track that so that I can use it as a disability expense, whether on my CalAble account or on my taxes at the end of the year.
Very exciting. Thank you, Christina. Let's move on to our next slide. So hopefully you are excited too. You're like, oh, you're curious and you want to know more. What do I do next? Let's go to our next slide. So how do I sign up? So there are many ways you can, and many doorways to enrolling to healthcare benefits. There may be, you may have access to some resource centers in your community, such as Aging and Disability Resource Center. You can walk in there, you can contact them and ask them to help you enroll with healthcare benefits, health insurance benefits. You can log on to your website for Covered California, the health insurance marketplace, and answer a series of questions, and it'll filter down to insurance plan options for you. You can reach out to the Department of Public and Social Services or your local DPSS office to help sign up for health benefits. If you're employed, you just picked up a new job, your employee benefits manager and their HR department can help you enroll in health insurance benefits. And we're highlighting here Medi-Cal because with Medi-Cal, you can enroll in many ways via mail, in person, or online. And then the next box here, when am I eligible to participate, or when am I eligible to participate in benefits? If you're employed, usually your insurance benefits will kick in on the first month following your date of hire, unless otherwise indicated. For some employers, they'll give you insurance from the day you start your job, that date of hire. So if you're wanting to know when you're eligible to participate in benefits and you're not really sure, check with your manager and they can inform you. And for Medi-Cal, the nice thing with Medi-Cal is once you apply and have been approved for Medi-Cal, your benefits start that month that you applied. So it's pretty quick. And then the last question here, who will elect my benefits package? So your Aging, Disability, and Resource Center or other resource centers in the community can help guide you through this process. Again, if you're newly employed, your benefits manager or your HR department can help you. They'll provide you some choices and help you walk through those choices and answer any questions. But ultimately, you will be selecting the benefits package. So you're a big part of that decision. Let's go to our next slide. This sounds like a lot still. So where can I get additional help? So if you're employed, newly employed, you can go to your employer company webpage. Most of them have a page that talks about anything and everything related to your employer, benefits, etc. You can go to that company webpage. Again, you can go to your HR department. Your employer may have new hire webinars or on-site presentations that can tell you more. And if you've chosen an insurance plan, you can go to that health plan website and look at what information is shared there. So if you choose an Anthem plan or a Molina plan or Kaiser or HealthNet, each health plan has a member website for benefits and you can search information there. You can also look at the Evidence of Coverage Handbook. That's a big fancy terminology for basically this is your handbook that lists out all of your healthcare benefits. And you were usually mailed that right after you apply for your insurance and get enrolled. That's on hand for you to go through as well. That's also available online with your insurance company webpage. You may want to go back to your employee benefits guide or catalog to look up information. And there may be employee resource groups offered by your employer that can help you with additional information.
And this is Christine. I'll just add a couple of things. You might be wondering, well, what if I have Medi-Cal and I go to work and my employer offers their insurance? You can keep your Medi-Cal depending on maybe you go into the Working Disabled program for California. You can choose to enroll in your employer coverage and keep your Medi-Cal as your secondary. So that means that pretty much anything is always covered. And we just we want to recognize, and because I've worked in nonprofit for so many years before coming to a corporation, a lot of these bullet points are for larger companies. Nonprofits don't necessarily always have all of these bells and whistles because they work on a much smaller scale than corporations. So they might have a couple of these things, but if you work for a for-profit entity, they are more likely to have these things. And one of the points that I had no clue about in nonprofit world was, what is an employee resource group? And everybody kept talking about it when I came here. And I thought, what am I missing? I don't get it. And fortunately, I have a really great colleague who explained to me what it was. But they are groups within the company. They might not be the direct staff members or coworkers that you work with, but people across the entire business who might have backgrounds in different cultures or heritage groups that you care about. And some companies have a disability resource group. So here at Elevance Health, we have Advancing Disability Inclusion as our resource group. And that means that I get to work with people that have a disability perspective, both personally or as allies, that can relate to me like folks maybe that could relate to me when I worked for an independent living center.
I love having Christina on this presentation with me. Thank you for that extra insight. All right, let's go to one of our last slides here. Here is a list, a short list of some of the resources that are available to you, along with some links. So this is just a reference when we spoke earlier today about those essential health benefits. The reference for the ADARC, or Aging and Disability Resource Connection, links for the marketplace, ways to apply for Medi-Cal, reference for that Disability Benefits 101, check that out, and also links that reference your healthcare rights and how to file a grievance. You know, there's policy and procedures related to that. And at the very bottom, so long it got a little bit cut off, but a link that also takes you to the Office for Civil Rights. So we're going to end our presentation here with our next slide. Thank you for your time, and let's maybe open the floor for any questions. I'll hand it back to you, Aubrey.
Yes, thank you very much. Okay, so we do have a question. It said, if a doctor refuses a treatment you've asked for, what are your options? Do I tell them to put in my chart they've refused service?
So to kind of a key point about healthcare and healthcare insurance, there's always a disclaimer, that's a reminder that says, based on medical necessity. So you may want to service or a treatment, and the doctor will review that with you, evaluate or assess you for your need for that service or treatment. And then they have to consider, is this medically necessary? And so there's criteria around what that means to be, medically necessary treatment. Like without this treatment, what does that impact to life or limb if this treatment is not received? Also with insurance, there's a lot of history of healthcare, and there's processes that are known as best practices to follow. So it's not even just up to a doctor who's practicing medicine to decide if you get a treatment or not. There's this whole pathway of information that they refer to, and different levels of treatment that they may need to try with you first before moving on to the next level of treatment. So if your doctor, you can have a conversation with your doctor. I think I need this treatment. What do you think? And they're like, well, I think we need to try something else first. Continue probing and asking questions till you understand. Even sometimes your doctor may submit a request or for authorization for a service that you or he agree that you may need. It could be the medical group who says, well, not sure that that's the right treatment, or we're not sure that that's the right provider to see first. This is the recommendation that we're going to give as next steps. So you should get that in writing. That authorization approved or denied, you should get a record of that information for your own reading and your own reference. And then within that document, there'll be next steps in case you want to appeal that decision or seek a second opinion. So that's you can work with your doctor who can advocate for you on your behalf. You can ask for a second opinion, but there's also steps where you can appeal those decisions. And even if that decision's been overridden or denied, there's still steps you can appeal that process as well. Anyone else want to pitch into that, Christina? Or does that help with that question?
I'd love to hear if the participant has any further questions about it. You did a great job, Lisa. I think something that I didn't realize until I came over to work for healthcare, and I don't think I shared, I've only been here for 18 months, so I have a lot to learn. And as a person with a disability who's used the health system my entire life and have disabled kids and a disabled husband, boy, I definitely don't know everything that I needed to know. But with that said, one of the things I've learned that I didn't realize is sometimes it's not the doctor that's making that decision. They're unfortunately, I think, put in a hard position sometimes because they might think that that treatment or that prescription or that specific type of wheelchair or hearing aid is needed, but the insurance company doesn't. And the doctor, like Lisa said early on, the doctor is a part of the network that gets paid from that insurance company. But sometimes there's doctors that work for a variety of different insurance companies. They have different networks and they have to bill the insurance company based on who's your provider, which doctor, which insurance you have. And just to say, I used to get really upset at my doctors for not approving things, but then I realized after working here that it's not my doctor. It's the insurance company that I have to appeal. My doctor wants me to have something, but my health plan isn't allowing it. So I just know for myself how frustrating it can be to go through that process as a person with a disability. And had I really understood the system more, I maybe wouldn't have come down so bad on my doctor and their office.
Yeah. And sometimes, sometimes it can feel like a struggle. But many health plans will also offer case management services. If you're really struggling with accessing care or getting the care that you need, even if the care that's been authorized, but you're having a hard time getting it, like DME to the home or home health to the home, many health plans will have case management nurses on hand who you can call up and ask for. I need help with these things. Can you give me a case manager? And the health plan will assign a nurse case manager to you to help you achieve some of those unmet goals or address some of those challenges of getting the care that you need. So that's something to ask for.
That is like really helpful, guys. Anthem does an incredible job in that area. We have great case managers that really step in as advocates to make sure that you get your needs met. So just know that that's there, but also not to give up, because what you know is right for your body is absolutely important, the most important thing. And same goes for medication or anything like that. Like, and case managers can really help. The other thing that I think folks maybe don't really know or realize, and I'm still trying to figure out like how people get the information, but if you're on Medi-Cal, depending on the plan you're with, they offer additional what we call social drivers of health benefits. And so it might be that they offer rides to the doctor's office or the grocery store, or they offer medically tailored meals because you have diabetes, or maybe a subscription to a gym or wellness classes online. It's in the world of healthcare today, it is so much more than just the standard and regular healthcare that we've known historically and that our parents know. It fills our what we need to survive and live healthy lives. And sometimes that means housing, that means a ride, that means food. It's a lot more than just healthcare these days. So also, if you're struggling in some of those areas, calling a case manager, calling and saying, I need a case manager, really helps.
Yes, definitely. I mentioned earlier that member benefits handbook. Sometimes that looks like a phone book coming to you in the mail, or you can access it online. But even then, you may get kind of lost in some of the information because there's so much information. But keep your insurance benefits card handy in your wallet, and get comfortable calling that member services number to ask your questions. And that'll be another first step to directing you to the right person to help you. What else? Any other questions out there?
No other questions. A comment. They said they answered my question. So the
Perfect.
person who asked about getting a record of that interaction. They felt like you answered the question. So thank you both.
Sure, sure. Yep. The health plans are really regulated, meaning the health plan has to meet a lot of requirements to serve our members. So, it can be a really good partnership if you take advantage of it, But yeah, call the call center for questions, ask for a case manager whenever you need any assistance. We're here to help.
Awesome. All right. Thank you so much, Lisa. And thank you so much, Christina. That was wonderful. We are going to have a short break, but we're also going to invite Chloe and Gabby to come give a tip. But if you do have to use the restroom or get a drink, this is a great time to do that before our next presentation. All right, take it away, ladies.
Hi guys. So my self-care and wellness tip is to try a relaxing activity. Explore relaxation or wellness programs or apps which may incorporate meditation, muscle relaxation, or breathing exercises. Schedule regular times for breathing exercises and these activities and other healthy activities you enjoy, such as journaling. And that's the tip. Questions? Yeah, if you guys have any questions, you can put that in the Q&A and we'll be here for a while.
All right. Thank you, ladies. We will get started in a few minutes. So take some time and take your breaks now, and we will get started on our next presentation shortly. Begin once again. We are going to now introduce Raquel Ramirez and Denise Santora. They work for RACV as Work Readiness Independent Living Specialists. So first I am going to read their bios while we get their presentation up. First we have Raquel, and Raquel she works, as I said, as a Work Readiness Independent Living Specialist at RACV. 3 things about her: she is a mother of 3. She can't start her day without coffee. And on her free time, she likes to do photography. I know, I've got mine too. Yay. And then Denise has been with RACV for 1.5 years. Before RACV, she worked for a day program for over 10 years. She enjoys helping others and loves to see her consumers blossom and excel at their talents. When she's not working with RACV, she runs a small cottage food business out of her home, making custom cookies and other desserts. She has 3 children, 2 bonus sons, and 2 grandbabies. And we love your cookies, Denise. Thank you. But welcome, ladies. You guys have the floor.
Good morning, everyone. I just wanted to stop and say thank you guys for all joining us this morning. Before Denise jumps into her presentation, I am just going to introduce the real team. So like Aubrey had said, my name is Raquel. I work out of the Fresno office here at Resources for Independence alongside with Christian. He's one of our newer employees, but he's also in the Fresno office. And then Miss Denise is located in our Merced office. So Miss Denise, I'm going to go ahead and let you take it away and start our presentation.
Thank you, Raquel. Good morning, everyone. And if I could have the next slide, please. So we're going to talk about resumes today. And so what is a resume and what's its purpose? Resumes are the first form of communication to a prospective employer. The purpose of a resume is to highlight your most relevant and important experiences, skill sets, and accomplishments. So you may use a resume to apply for jobs, to apply for grad school, scholarships, or when asked to serve as a professional reference. Next slide, please. So a resume consists of some important sections: a header, the objective, education, experience, and references. And on the side here, we have a little example of kind of the format. You want to keep your resumes to 1 page, just because you don't want it to clog up when you're handing it to the prospective employer. You don't want a bunch of pages, you just want 1 simple page. And so we're going to go over each section and give some little tips of what you should put on them. Next. So the header is going to be at the top of the page, and generally you want that. So in your resume, you want it to be 11 to 12 points on your font, but for the header, you want it to be a little bigger, 14 to 16. And so you want to put your name, your full name, and it's going to be a little bigger. You want to maybe bold it. You're going to put your address or location. So instead of putting your street address for safety reasons, you want to just put the city and the state that you live in. So as the example we have here, Ashley Lopez, Fresno, California. You want to include your email and a phone number so that prospective employers can get a hold of you. So you want your email to be professional. I know sometimes we have different emails for personal use, but we want this to be professional. So it's a good idea to put maybe your first initial, last name, and at whatever server you use. You want a phone number that you have access to, so that when they call you, they directly get you, instead of opposed to getting like your mom or someone. If you have your own cell number, you want to give them yours, and you want to make sure to answer it so that they can get a hold of you. So the objective and education. So an objective, you want to summarize what you bring to the table and how you will contribute to the company. So you want to kind of sell yourself. You want to let them know how you're going to make an impact to their company, what you're bringing to the table, how you're going to better their company. So you want to keep it short, 1 to 2 sentences. An example of that would be to obtain a challenging position in the retail industry that will allow me to utilize my customer service. And the education, you want to put present to past. So the name and location of the school and the date you attended, and any relevant courses, especially relevant to the job to which you're applying for. So if you don't have any college education, you would just put your high school education. And so you could put volunteer work here, I believe. Any skills that you're going to have to bring to the table. Next slide. Can I have the next slide, please? Okay, so the do's and don'ts of a resume. You don't want to use a non-professional email. So we have an example here, littlescrappy91@yahoo.com. That may be okay for your personal stuff, or if you want to use it for your Facebook, but for your resume, you want to have one that's just going to be correspondence for your resume, for prospective employers to contact you. So a professional email would be rsmith@yahoo.com. You don't want to use a font that is too difficult to view. So no, they have a lot of cute little fonts that may be.
Hey, Denise. I'm so sorry to interrupt you. We have a request that you slow down your speech.
Oh, okay. So let me start that over. So the do's and don'ts. You don't want to use a non-professional email. So littlescrappy91@yahoo.com. That would be an example of a non-professional. So that would be used more for your personal. You do want to use an email that is professional. So rsmith@yahoo.com. First initial, last name. Keep it simple. You don't want to use font that is difficult to view. So there's a lot of font that it may look cute if you're making a little flyer for something, but for your resume, you want to keep it professional and easy to read. So when employers are looking at your resume, if they're having a hard time reading the font, they're going to just kind of scrap it or put it to the side. So you want to catch their attention. You don't want to have to make them struggle to read your resume. You don't want to use spelling errors or grammatical mistakes. So you want to make sure You proofread it before sending out. And you don't want to use the same resume for every job. So you want to save it to your computer and you want to customize your resume to each job you're applying for. So when you apply for one job, you may not use the same wording that you do to apply for another job. So you want to be able to customize it. Next slide, please. So a couple resume building resources, and these can all be found online, is myperfectresume.com, Zeddy.com, resumegenius.com, topresume.com, and resumebuilder.com. So I'm familiar with the My Perfect Resume. I know a couple of my consumers, we've used that one, and it's pretty easy to navigate. They have a lot of selections where you can put in, where they'll give you prompts to they'll select wording for you. And so it's easy to use. You can make free resumes. You do have to pay to print it out, but there is a $2.95 fee for like 2 weeks. So you can make your resume and print it out, maybe save it to your computer to edit it for later. Next slide. And so now I'm going to pass it over to Raquel.
Thank you, Miss Denise. I do see that there is a question in our Q&A. I didn't mention this in the beginning, but we will be answering the questions at the end of our presentation. So Miss Denise, if you can just look at that question and just have the answer ready for them at the end of mine. So I'm going to be talking about confident communication, interview skills. Next slide, please. Okay, so what does confident communication look like? I'm gonna go ahead and stop for our ASL interpreter. All right, perfect. All right, so what is confident communication? So it can look like many different scenarios, depending on your perception, which is the beauty of it all, because we all are different and we all have different communication styles. But here I'm going to explain 10 bullet points that I found for confident communication during an interview. So number 1, active listening. Number 2, using the right communication method. Number 3, friendliness. Number 4, confidence. Number 5, being your true self. Number 6, volume and tone. Number 7, being calm and consistent. Number 8, respect. Number 9, nonverbal cues. And number 10, responsiveness. Next slide, please. All right, so active listening. So while we are active listening, we really need to be paying attention to the conversation that is right in front of us. We need to understand the person who we are communicating with and not trying to force our opinion on them. The next bullet point is using the right communication skills. So when we're at an interview, our vocabulary will be different in comparison to how we speak to our friends or to our family. So not using slang or inappropriate language. Next bullet point, friendliness. Remember to smile, which is easy to forget, especially when we get nervous. So remember to breathe, stop, pause, and smile. All right, and then our next bullet point is confidence. So right here on the side, we have a clip art of a man who's ready for an interview. He has his interview attire on. He is standing on, it looks like a mountain. He has left hand on his left hip, right hand on his right hip, and he is standing in that Superman pose that we all know. So before an interview, take a moment, a couple minutes, and put on that imaginary cape and lift up your shoulders, stand proud, and go save Gotham. I'm just kidding. We'll just do the interview for now. The next slide, please. All right, so being your true self. So we've all heard the quote, fake it until you make it. So during an interview, we're not going to want to listen to this quote. Employers want to hire people who benefit their team. So be yourself. A lot of the times, employers can even tell when you're not being authentic. And let's be honest, we all are unique in our own ways, and we all want to be no other one but our own self. The next bullet point is volume and tone. The tone of our voice also influences how people perceive us. So if we're speaking in a monotone way, when there is no pitch, we may lose our audience attention. Or if our voice is too loud and projecting, then it may seem like we're angry or we're yelling, which goes hand in hand with being calm and consistent, which is our next bulletin point. So we want to be mindful of how we are expressing our voice. Next bullet is respect. I feel like this is a big characteristic to have for not only the ones that we are speaking to, but for ourselves. We need to strive to maintain our morals, be friendly and courteous to everyone that we meet. Next bullet point is nonverbal cues, making sure that we are sitting up, that our arms aren't crossed or fidgeting, making sure that we are facing our interviewer and showing our interest through our body language. And the next one is responsiveness. When communicating, aim to provide information that is straightforward, brief, and to the point. We want to make sure that we are showing our interviewer that the words that they're being spoken are being heard, processed, and reciprocated. Next slide, please. All right, so this right here is our interview checkoff list. We have our before, during, and after. So before, we have self-preparation and research. So self-preparation is practicing our mock interview skills. And then for listening our qualifications and knowing what we bring to a table as an employee. For research, get to know the company that we may be potentially working for and the job description. What we talked about in previous slides with mastering our emotions and logistical planning. During the interview, communication and introducing ourselves. So bringing those 10 reminders on what confident communication looks like, be confident in who you are as an employee, and really showing those qualifications. Listening and asking questions, listening with the intent of asking questions that pertain to our interview. Sorry, Jordan. And then after, so if following up with our interview, if we don't receive an immediate, hire on the spot, then, ask them, when do you think they'll be able to get back to us? And then reflection. We can all grow from an interview, even if we, crush that interview. There's always room for alternate responsive. We can also think of, different ways that we might answer the questions the next time around. And that is just part of growing as an individual. Next slide, please. All right, so this is a quote I'm going to leave with you guys. Sometimes, we don't get that job, but it doesn't mean that we stop, because there is a job out there for us that will benefit us and allow us to be the best employee that we can be. So the question here, or the quote here is, the question isn't who's going to let me, it is who's going to stop me. So remember to have those confident communication styles, and even if our interview isn't the outcome that we anticipated, there might be a next one. And then, like I said, there's always more room to grow, and just using those different confident communication styles to make sure that we go through the process of a strong interview. Next slide, please. All right, so right here is our contact information. Like we mentioned before, we are Resources for Independence Central Valley. On the bottom, I have listed all of our emails, myself, Denise, Christian, and then Tanisha, if you guys have any referrals and anyone that has any questions about our program. And that is all my slides. If we can go to the questions.
So there was one question, what if you don't have a high school diploma? So if you don't have a high school diploma, you want to put the school you attended, and you would just include that your education is still in process, and you want to list the date that you expect to graduate. And if you don't, say you finished high school, but you didn't get your diploma, you could just put that your certificate was incomplete, and maybe list that you are in the process of going through an adult program to get your GED or your high school diploma. Next question was, does the My Perfect Resume website offer example resumes for you to look at for reference? And they do. They give you, so they offer a couple different templates. You can put your information in, and you can go on there and it'll show you how it will look with that template with your information. So it's pretty neat. It's easy to navigate, and it's we really liked it a lot.
And then I'll go ahead and jump in for this next question, Ms. Denise. It says, when will we get a copy of these slides after the workshop? And the answer is yes. If we will be having them all, I believe, Jordan, if you could help me out with this, there is.
Yeah, so I'm at the end of the webinar. Everyone who's registered will get an email from me with links that were discussed, contact emails, and the presentations as well. So you'll get everything. And if something was missed, you'll have the email of the individual, so you can reach out and discuss with them.
Does anyone have any more questions for Denise or I? If not, Jordan, I'll let you take it away.
Yeah, so if I'm looking at what we have next, I have a couple jokes for everyone that I can tell. So why did the math book look sad?
Why?
Because it had too many problems. I got another one. I wrote these down. Where did that go for me? Oh yeah, okay. Why did the computer go to therapy?
Why?
Because it had too many screens to deal with.
Why?
But yeah, so basically, what that means is we have a break, right? Next.
Yes, we have a break, and we will be starting our virtual resource fair at 12. So we do have a little extra time. We have shared the link, so we hope that participants can leave the webinar and join the virtual resource fair link at 12. We'll start that at 12 to 1, but then we will jump back on the webinar after that at 1 o'clock to come back to the webinar.
So this same link that you used to join this, you'll join after 1, and at noon, I emailed everyone out a list for the virtual resource fair. So we'll see you guys in an hour on that link, and then in 2 hours, we'll see you back here.
All right, see you guys soon.
Yeah.